This all started about a year and a half ago. I feel bad for some of the people who's had this for 20-some years. I can't imagine with having this pain that I've had for this past year and a half for 20-some years. It is very excruciating. Mine started very mild. It started like an exposed nerve on a tooth. So I immediately went to the dentist. My dentist looked at the teeth. He did all these tests, thick x-rays, and nothing wrong, he said. So I just kept working and going on with my life, and a few weeks later it kept getting worse. So I went to the dentist again. I said, there's got to be something wrong with my teeth. And he sent me to an endodontist that wanted to go ahead and do some root canals on me, or maybe possibly pull a tooth. He knew that I was in a lot of pain. Every time he just went and touched it, I just went off my seat. So it was, he basically said, I would like you to go to a neurologist before we do anything, because something's not right here, because your teeth look fine here, your x-rays look fine, there's no inflammation, no swelling in your gums and anything. So he referred me to a neurologist. So I went and spoke with this doctor, and he basically told me that it was trigeminal neuralgia. And I go, what? Trigeminal what? And I never heard of it. And so I started looking it up, and he started showing and explaining it to me, and he said, well, you need to try this stuff here. He got me on some pain meds and some medicine. It didn't agree with me one bit, so I went back to him, and he tried some other stuff, and it didn't work at all. So went back to him one more time, and he said, well, we're going to probably, your other option, since this isn't working, is have surgery. They were wanting to use the gamma knife method on me, which would paralyze, basically, my side of my face. They cut that nerve, and I wouldn't be able to feel my eye. I would never know if I had something in my eye, and that could be very dangerous. So paralysis was not an answer for me. And meanwhile, it was just getting worse and worse and worse. It was affecting me so bad I can hardly get out in the morning to go to work, and eventually affected my job. I lost my job because I couldn't function right. Shortly after, the pain started subsiding, so I figured maybe it was all due to stress. Maybe stress brought this on, because I did have a stressful position. It started going away, and about 4 months ago it came back, and it started out light again, and then during the holidays it was hurting so bad that I couldn't function. I was even worse than it was before. It was affecting my family. It was paralyzing. I couldn't get out of bed in the mornings. I really couldn't. I couldn't eat well. I was losing weight. I had to drink soup. You know, every time I tried to chew, I couldn't brush my teeth, and it just got to where I didn't know what to do. So I went to the neurologist one more time, and he said, well, we'll try the medication again, and we had to think about going ahead and having the surgery. So I went home that night, and I started looking on the web, and I started looking under trigeminal neuralgia, and I found the website to Laser Med Center. We came down a little over 2 weeks ago, and after my very first treatment, I felt a little bit of relief. When the nurse gets you in there, she puts your protective eyewear on and takes the laser and puts it about an inch from your head, and the beam is about the size of a baseball, and it's a warming feeling. That's all it feels like. It's like a warm washcloth or an incandescent light bulb about, you know, that far from your face, and it's very warming. It's no pain at all, and she just moves it all through those nerves that run through your jaws and your forehead, and she does that for about 15 minutes, and twice a day. 1 to 10, 10 being the worst. I mean, that's unconscious almost. I was an 8.5 coming in here. I was at least an 8.5. After my first week, I was down to like 4. I was eating again. I was enjoying all of the food down here in Myrtle Beach, and which is great. I didn't eat like that for a very long time, and then after the second week, it's I'm about a 1 right now. It made a new man out of me. I got myself back, is what I'm saying. And my daughter, when I get back, she's going to be so happy. She's going to have her dad back. I want to give the staff there my great deal of thanks, the professionalism of them, and the kindness and concern. And I appreciate it very much. And I just want to thank them for everything.